Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome to the Beauty Equation. Today, we want to start with something that we hear all the time, quietly, almost apologetically. A lot of times women will come in and say, I don't feel this tired, or I don't feel this old. I don't feel like myself anymore. Essentially, they don't recognize who they are in the mirror anymore.
Oftentimes women, they'll say to us that they don't want to look younger. They just want to be able to reflect the world how they feel on the inside. And it starts to chip away at their confidence. They'll wake up, and I think we all do this. I know I do it myself. You know, you wake up in the morning, you don't have your makeup on, you're still tired. You've just about washed your face, and you feel like the dark circles under your eyes look darker, the wrinkles look deeper, your face might look a little bit puffier. And that reflection that you see in the mirror, it does affect your confidence and how you hold yourself.
100%.
And oftentimes, what women are trying to express to us is that they want something so that they wake up looking refreshed and start their day on a good foot. And
Yeah.
it's a change that sometimes women will express as they feel like it's happened overnight, but it's actually quite a slow process when you come to understand it. And there are a lot of little things we can do along the way, but we won't be jumping into treatments today. We're really going to be kind of exploring that disconnect that happens, why sometimes in midlife that might feel so sudden, and also explore why we tend to always blame ourselves for that experience.
Yeah. And it's so common, and we don't talk about it. Right. And, that whole idea, and I find that this is so common amongst women later on in life. When you're younger, you're interested in makeup maybe, and you're like, oh, the contour, the this and the that and the whatever. But I'm telling you, I want none of it. Like, if I could just get up and go, that's what I
Yeah.
want. And I hear that all the time. Like, I just can't be fussed about it. But at the same time, I want to look good and
Mhm.
refreshed. Um, so yeah, it's an interesting time.
I think that reflects the community that we're in too. We are based in a very outdoorsy community where a lot of women like to be able to get up
Yeah.
and go and feel confident when they're out on their hike, not wearing any makeup, maybe just a bit of sunscreen. Oftentimes, the first thing that will appear, which I find, and I think Amanda, you can probably test that to a lot of your skin consultation, is the pigmentation changes that will happen that will make you look more aged, or you'll feel like you want to cover up. And that's when things kind of can start to like creep in and affect the way you feel about yourself and feel like you need to wear that makeup.
Yeah, I think one of the biggest sort of themes, in conversations that I get to have with women is that disconnect between how they feel on the inside versus what they're seeing in the mirror, whether that is
Hmm.
brown spots or wrinkles or
Mhm.
bags under their eyes. And it's just so prevalent. And
Hmm.
oftentimes they don't come into the consultation saying, my inside, my outside don't match.
Mhm.
Sometimes they
Yeah.
do, but often they don't. More often than not, I would say they don't. They come in because they're bothered by maybe a particular line or a brown spot, and then through the process of having a consultation, we can delve a little further, and it often sort of comes back to that central theme of I don't like, who is that person in that picture? Like, oh my gosh, is that what I look like? I
Yeah.
hear that a
Yeah.
lot.
I've heard a lot like, I saw a picture and I didn't recognize myself,
Hmm.
or I look like my dad. That's one that we hear sometimes, right? And, to your point, our face changes. It changes slowly. for sure. I would agree with you, Christelle. But it's a funny thing, and a lot of our patients will say this to us. It does feel like there's a point at time where the change is rapid. And I think I certainly experienced that. I do think that it coincides with some of the changes that happen hormonally, with
Hmm.
our estrogen going down, our progesterone going down. And we start to get that collagen loss, we start to get that skeletal resorption and all of that. But it kind of plugs along really slowly, almost kind of you're holding your own. And then it's like something snapped the camel's back and it just all changes. It
Hmm.
may not be overnight, but it can happen within the period of a year or so. And I feel like there's a breaking point almost, where
Hmm.
once you pass that threshold of volume loss or past that little threshold of, we lose 1% of our collagen per year, yada, 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 but that adds up. And when it gets to 30% or 20%, you see visible changes with like that skeletal and volume loss. So it's
Hmm.
experienced that way. And it could be that leading up to those years, socially, we're very busy. I think of my life, like, I don't have time to look in the mirror when my kids are. Like 2 years ago, I was driving 4 hours a day, taking my kids to their various activities. I have a son and a daughter, and they were both not driving yet. I didn't have a minute in the day, and I'm sure you can attest to that as well, Amanda. And
Yeah.
you have younger kids, Christelle, but like I don't have time to like sort of look. And then when you have that space to sit down and you're like, oh my God, things are different. So I think it all plays
Yeah.
into it.
Or when you catch yourself in the mirror of your car. Like,
Oh,
I find that that's
yeah.
the one where you're
The
like,
rearview
"Ooh,
mirror is just evil. It's like
it's horrendous."
airplane bathrooms. Ugh.
Right.
I always
Yeah.
say, well, I guess you can't bring tweezers now, but it's the airplane bathroom is a good place to find those hairs that just randomly pop up.
And I think that's why they randomly, like, all of a sudden pop up too. It's not like they grow 40 feet a day, but it's like you don't stop to look at yourself. And then when you do, you're like, what the heck?
Like, and
Mhm.
why didn't anybody tell me that I had a 2-inch hair
Right.
growing out of the mole on my neck?
I think fatigue, the lack of sleep as well has a huge impact. So you'll see it in phases. So like in those early years
Yes.
where like, mothers are breastfeeding, getting up a few times a night, you're not actually sleeping and having the chance for your tissue to regenerate. Same thing starts to
Yeah.
happen in the perimenopausal year where your sleep gets quite broken,
Yeah.
and that's often hormonally driven. It affects your circadian rhythm, so your sleep cycle, and you'll get that middle of the night or early morning waking, and then you're not getting that regeneration.
Right.
And it's a process that, as you mentioned, it's the fluctuations in hormones, and sometimes it'll be stable and then you get a period of chaos. And then if you throw in life stressors within that, you'll have those huge changes that you're getting the hormonal changes affecting the tissue. You're not sleeping, you're not regenerating. And maybe you have a lot of stressors either in work or in your personal life. And that creates a lot of inflammation and that will show up on your face. So it has quite a
Yeah.
compounding effect.
Yeah. All of it. Right.
Oh, yeah.
And I think a lot of times though, like to that, so it's interesting listening to these conversations about menopause and sleep and all that too. Like it can be a little bit anxiety provoking. And I think a lot of times people feel like they have to do everything all at once. And here's one more thing that I got to do. Now I'm like
Hmm.
bullied into eating protein, right? Like we've all seen
God.
that, right? So it's a lot. And then I think that naturally a lot of patients are like, I must be doing something wrong. This
Hmm.
is like only happening to me.
Hmm.
Pile on top of that the sort of lack of evidence and wrong evidence, frankly, that we had around hormone replacement and the impact of our hormones on our health in general as women. Like that comes very easy and quickly to us that it's something to do with just me. I'm the only one.
Hmm.
So, I mean, I think that's one of the points of our conversation. It's not just you, it's
Hmm.
totally normal and it happens to everyone. And let's start talking about it like it's normal human aging.
Yeah, I guess the question is like, if it's so common, then why do we all feel, well, or why do many people feel alone in this struggle, right?
Good question.
I
It's a
think
good question.
oftentimes we're embarrassed or we're afraid to show our vulnerabilities. We live in this culture where you should be showing up in a certain way. This, image or these masks that we put into the public eye, and you almost feel left behind or like something is wrong with you if you're not fitting in that mask or that image of how you should look and feel. Or it'll go to the other extreme where there's almost the sarcasm, the comedy around it. And there's a lot of women in this middle ground being like, well, which camp do I belong to? Am I happy to go
Hmm.
just full on satirical on what's going on in my life? Or do I want to pretend like everything is fine? And then a lot of the times when you're not feeling great, you'll go maybe to your family physician and nothing shows up on your blood work because there's nothing that we can test for because of the way things are. And then you're like, well, if nothing's medically wrong with me, maybe it's all in my head. And a lot of the times women will feel too uncomfortable to even mention it to their friends, or, they suffer in silence.
Hmm. Well, I have a few thoughts on that. I mean, one of them is that as women, we just can't get it perfect, right? We're not allowed to.
Yeah.
Either you're too much, you're going overboard, trying too hard, or you're not trying too hard. And somehow that says something about your moral character, which,
Mm.
I mean, it's ridiculous, but we see it in all aspects, not just our how we look, right? It's how do we take care of our families? Do we helicopter our kids or not? Like, name
Mhm.
it, anything, right?
Mhm.
So I think that's one thing. And then I think that, y- you know, s- celebrities are not completely honest about the length to which they have to go to maintain their appearance, right? They have celebrity chefs, they have people that help them work out, they have
Yeah, has
people that
anybody
handle,
seen Oprah lately?
yeah,
Like,
like,
WTH? Like, what the heck? I'm like, how old is she? 72? And
yeah,
she looks better than she's ever
yeah,
looked, I feel
Yeah,
like.
she
Like,
looks better than she
yeah.
did like in the 90s.
Right?
Yeah.
I know. It's incredible. And don't
Yeah.
tell me that didn't come with a whole heck of a lot of help and money. Like, everybody's supposed to live up to that. Like, it's not realistic. With the surgery, like, when do we get to stop? When do we get to get off? It's a lot.
it's a lot. So, yeah, to your point, you're kind of, we're all damned if we do and damned if we don't, right?
Yeah.
And there's so much shame and guilt tied into, you know, doing for ourselves in so
Yeah.
many ways as women. Um,
Yeah.
who
I
does
love
she
to see the younger women, right? Like, yeah, who does she think? Like, the
who does she
younger
think she is,
women,
right? Yeah.
yeah, like, they have no compunction about investing in themselves. Um, but it's always the over 50s that come in that are like, I can't, they're close to retirement. They've done everything for their kids. They've taken care of their financial responsibilities. And even yet, to spend that little bit extra on something that they view as frivolous, right, is hard for them. So it's just interesting to walk along people and help them through this, right? It's
Mhm.
different for everybody.
And I feel like, would you agree with the statement that um, women often blame themselves?
I think that's an emotion that comes easily to us.
Mhm.
Yeah.
It feels easier.
Yeah. We take accountability for a lot of things that aren't even within our realm.
And we have to learn to get mad.
We talked about this today. Yeah.
Christelle and I were talking about this today.
How
Like, it's,
anger isn't not an emotion that is easy for a lot of women. Uh,
No, we're very much socialized against it. Well, at one point,
mhm.
you could be hospitalized for it, couldn't you? I mean, you would be a hysteric, right? And
Hysteria
you
was a
would be
medical
hospitalized,
diagnosis. Yeah.
right? I mean,
And
that wasn't even that long ago, maybe two
no.
generations. It didn't take much.
Mhm.
Just wanting to have a little bit of freedom and voicing that could
Mhm.
land you land you in a place that you maybe didn't want to go. So, yeah, anger is dangerous for us, or has been.
Hmm.
So we certainly don't want to wear it on our faces.
Heck
No.
no.
And that's probably one of the first treatments that people kind of in our, in the 50s, if they haven't done anything, it's often they start to feel like they look annoyed or angry or unapproachable. And it's, coming in and addressing their frown lines. It's pretty
Yeah,
Yeah,
common.
for
even in
sure.
from their 30s onwards, often is at the anger, or the feeling like you're unapproachable.
Yeah.
Yeah. And it wasn't, I said to Christelle earlier today, I said, I'm white Anglo-Saxon Protestant. Like we are good at repression. And in my family, getting mad and being loud like that, it just didn't happen. Right.
Hmm.
Yeah.
So it's definitely not something I've
Yeah,
ever really identified with. So
yeah.
I
I
look
Yeah.
think we sit
forward to
more.
finding my anger in my
Yeah,
second half of life.
we sit more comfortably with like sadness and disappointment.
Yeah.
Right.
Yeah. Yes.
Or tired, right?
Hmm.
It's interesting because what I've tried to have conversations with people in my life who don't feel comfortable with that emotion, and I might say, "Oh, you look are you angry?" They'd much rather say, I feel tired. I'm just
Hmm.
tired."
Yeah.
It's interesting. So, I mean, I hope that as we can learn from our younger women in our lives how to take agency over things, and there are so many things that we can do from
Mm.
skincare to preventing some of this aging things that happen. We have lasers, we have so many things, but my wish for women is to be able to talk to people like us, just to talk about how they feel, and it doesn't always mean that you have to go under the knife or do the injections or do anything really, because I always like to say we're not saving any lives, but we sure can make them a whole heck of a lot better just by giving you space to have that discussion and then sharing evidence based things that you can do that are still going to be okay for your health, right?
I
Yeah.
think
And
I'd
what
like women to
we're
be able to feel comfortable to open up about what they see and not be taken advantage of. I was just recently had a girls' weekend, and a handful of the women there had gotten treatments. One was after multiple bereavements in her life, and she just wanted to have something back, some spark after all that loss. Someone else was, turning 40 and wanted to do something from her. And they were showing me photos from that time in their life and the treatments they had done. And they were overtreated. They were sold things that they didn't need. And that's where I think the responsibility lies with the providers, where it is really important to respect that person in front of you, um,
100%.
and guide them in that very vulnerable space. We get so much pressure as women, in the public sphere to look a certain way, that it's important that we do the right thing, less is more, and embrace the aging journey to look more rested and not try to give unrealistic results or unnatural results.
I had a
Hmm.
conversation with a young professional woman a week or so ago, a couple weeks back. And what bothered her was really she had seen video of herself from the side, and she didn't like her profile, and in particular this sort of angle under the chin and down towards the neck. And um, we sat and we talked, and when I actually palpated the area and kind of had a look, she doesn't have a lot of fat. It's just really more her anatomy and her structure. You could feel that there wasn't fat under the skin. It was more, you know, just you could feel the neck and all of the there was nothing that, there wasn't like a little fat pocket we could melt, and her chin hadn't sunken back enough. So what she settled on was just to start with, just addressing these frown lines here. And it was funny because she said to me after the conversation, she goes, "Wow." She goes, "I probably would have like bought anything you told me to do, but
Mm,
thanks for being honest." And I was thinking, Wow. Yeah, I guess I could have said, "Oh, you need a bunch of chin filler and let's cool sculpt that," even though there
Yeah.
was no fat there, and you know what I mean?
I think that's
We just
the
wouldn't do
danger
that.
in we're kind of sidelining the danger in this industry where it is private work. It's not as regulated as traditional medical work. And because the training is very much dependent on the individual and there's no set, say, residency program, we don't tend to have discussions around the ethics. I don't know if you've had many conferences or meetings you've gone to where we really focus on the ethics of treatment and the
Yeah.
responsibility. I think it's a conversation
Yeah.
that's starting to happen now and
I
is
think
well
so. I
overdue.
think, yeah. Well, I think so many different things can play into it. You know, there's a few things. So there are many different types of providers in the industry.
Hmm.
So from nurses to physicians to dentists and pharmacists even, and in other countries, beauticians. So their exposure to thinking about ethics is different than physicians. So I find that most physicians have an idea around the ethics to the point that sometimes they get deterred from even entering the field. But I would argue that the emotional sort of toll that aging takes in our patients, we see the difference that we make in their quality of life. So I personally don't have qualms around that at all.
Mm.
But, we have a variety of professionals in the field. And so that's one thing. And the other thing is that because the training is not standardized, and sometimes because we don't all think of aging the same way. And we may not have the same breadth of knowledge around the technologies available. And new technologies keep coming on the market rapidly.
Mm.
And most of our knowledge is gained through industry partners, which have their
Hmm.
own motives. Um,
Yeah.
Not every provider that you go see is going to have an idea of what's actually going to help you. So many
Hmm.
times people will sit in the chair and say, I don't like my side profile. I think I need a chin, because they've
Hmm.
seen a TikTok or whatever. And that person might not have the ability to analyze things, and not because of a lack of ethics, but because of a lack of just experience or knowledge. They might just go do it. So I think
Very
there's
good
a
point.
lot at play here. So it's not always malice or malintent that sort of
I don't, yeah,
has people. Yeah. So it's a complicated thing, isn't it?
it is.
Very. And I think too, like, if all you have is a hammer, then pretty much everything looks like a nail. I think that happens in this industry sometimes, where whatever that particular treatment is, whether it's a device or an injectable, um, and it's just a lot more complicated and more complex than that.
Mhm. And each person, each of our patients has to come to their own decisions with our guidance. And so, yeah, I'm just glad we can have these conversations.
So if you're feeling like things happened overnight, or who is that old lady in that picture? Yeah, you're not alone. You probably just crossed that little threshold where, come on, where I am, come on in. And yeah, I mean, and that's the other thing too. Like, the whole term anti-aging is kind of gross, really, when you think
Hmm.
about it, in the sense that it's something to be loathed or feared. And I think the best thing about what we're able to do is give people a little agency, right? So
Totally.
they
Mm.
can just feel like the inside and the outside are more aligned,
Hmm.
right?
Yeah.
And I can't think of one person in all of the conversations I've had over the years that, has said, here's a photo of me at 20. This is what I want.
No,
That never happens. And it's really like, I just want to feel and look a little bit more like myself again.
Hmm.
totally.
Mhm.
Totally. I'm so
Yeah.
glad we had this conversation. Yeah. So, for all of you listening, please put in the comments if this is something you've experienced. And, let's have these conversations. Let's bring it out. I certainly have seen changes in myself, and I want to hear about your experience.
Yeah.
Likewise.
So if you'd like help making more sense of what you're seeing, then hang out with us. We have
Mhm.
some great things to chat about.
Yeah, we'll be going into what actually happens down the line and discussing treatments and answering questions as they come along. So subscribe so you don't miss an episode, and we will chat to you soon.
Bye for
Bye
now.
now.
Bye. Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on the Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.